This episode is going to be very delightful, interesting, deep, and covering topics I've never covered before. And one of the things that just has me smiling before I even begin is because my guest is Dr. Alexandra Dubinskaya. I don't know if this is your experience, Dr. Dubinskaya, but I'm 55, and ever since I was a little girl, it happened again last week. People meet me and they say, Alexandra, what a beautiful name. And I just love that that's like the preamble to many people meeting me the first time. Do you experience that too?
Absolutely. And also because I grew up in Russia, Sasha is the short form of Alexandra. So most of my life, I would go by Sasha, and Alexandra, it's kind of like a holiday, like a more elevated name that you give in order to have that elevated experience. So yes, I definitely experience that, and I feel myself how it's like everything gets better when I go by my full name.
It's so wonderful. And I have a few people in my life who've called me Sasha because of the Russian connection. I have actually almost all of my heritage is Russian. But I also find it so funny that a number of people also, they'll meet me and say, "Oh, what a beautiful name. Do you go by Alex?" And I always say, "No, I like the whole thing. I'm a whole thing kind of person. That is my brand, my message, and everything I'm doing around marriage coaching as well." Okay, well, Dr. Dubinskaya is a board certified gynecologist specializing in urogynecology with an emphasis on female pelvic medicine and reconstructive surgery, female sexual health, and menopause. She's a founder of Los Angeles Institute for Pelvic and Sexual Health in Beverly Hills and is on a mission to help women suffering from pelvic floor disorders, sexual and menopausal concerns. There's a lot more to say about Dr. Dubinskaya, and I feel like as a physician, those are super clear sentences that I read. But for a lot of people, that's a lot of big Latin kind of sounding words. So a warm welcome. And would you say what you do using completely lay language?
Of course. What I do is not too many people know about this niche in medicine that I cover. So basically, I'm filling the gaps where the regular OBGYN can help women anymore. For example, when women go through the perimenopause, menopause, when they're done having kids, they start experiencing a variety of symptoms. Anything from well-known hot flashes to peeing their pants a little bit, or feeling the bulge in the vagina, that's something falling out, or start experiencing frequent urinary tract infections. And they don't really know where to go with all these problems. They go to primary care, to OBGYN, and they can't really get a full evaluation. They're being tossed back and forth. So urogynecology is basically a niche where people train for many years in gynecology and urology to combine this field to help with these conditions. And these conditions are more common than people might think. About 1 in 3 women who ever gave birth vaginally will develop urinary incontinence at some point in her life. So it's very common, but it's not a respected condition that you're not going to talk about it during a cocktail party like you would about a heart issue or headaches. So a lot of women suffer in silence, and when they come to me, they realize that, oh, I'm not the only one. A lot of women have the same issue.
Yeah, I want to kind of contextualize and normalize this conversation in a few different ways. One is I just have a flashback to being in my OBGYN rotation as a third-year medical student. Actually, maybe it was pediatric rotation where this happened. But anyway, it was a third-year medical student experience where there are babies who are born with baby acne, which means that they have, a skin disorder on their face. It's so visible. Everyone sees it. People come to meet the new baby and they're like, what's wrong with him? What's wrong with her? They get so concerned. But baby acne, as you know, of course, is a completely benign condition which fully resolves, has no lasting impact. It doesn't even affect the health of the child temporarily. It's like a visual blemish that fades. Whereas newborn babies with cardiac issues, cardiac defects, needing cardiac surgery, often the parents and the visiting family, at least initially, are much less concerned about that baby because everything looks fine. Whereas the baby acne, it's on the face. And so it's very concerning. Similarly, there's such interesting kind of sociological data about how proactive people were for immunizing for polio, because when people would get polio, so often they wouldn't die, they'd end up being crippled, and then we'd see them in wheelchairs, we'd see them suffering, and people would be very motivated. Whereas other more severe illnesses, people would just be more casual about because they didn't have the visual reminder. So what we're talking about has nothing to do with polio or baby acne, of course, but I think of the whole niche that you focus on in medicine, that it's so often invisible. And it's a little bit like, for most women, I think, in fact, I'd love to know if you agree with what I'm about to say, it's a little bit like putting the frog in water and then slowly turning up the temperature, that women get used to urinary leakage, like less sensation during sex, just having less function in the pelvic region, but it tends to happen gradually. So first, there's a little urine leakage with a really intense cough, and then it gets all the way to a mild sneeze or just like a little jump or walking upstairs. But it happens so gradually that women are used to accommodating, and it's not something that's talked about. So it's more like the cardiac defect in the infant, or the more terminal illnesses as opposed to polio. And that combined with the accommodation, I think I read at some point, what is it? Women wait 7 years to seek treatment from the first symptoms. So will you comment on that? I know I've like gone all over the place with that, but I'm really making a very specific point.
I think you absolutely correct. And we the women, we tend to adapt to our environment and take care of everyone else around us and like not prioritizing our health. And when they start experiencing some stress incontinence, like leakage with physical activity, okay, they stop going and playing tennis. Okay, they stop going to the gym, and it's not impacting them as much. But as a condition left untreated, it can progressively get worse. And what we can see that, okay, we're not exercising anymore. We also gained some weight. So our urinary urgency also got worse, but we can't really not be engaged in sexual activity. Or like we can, but it's going to affect our relationship. So what I sometimes see, women come to me and they were like, oh, we have an issue with sex. And we went to sexual therapist, we went to couples therapist, and nothing helps. And when you start diving into details, you're realizing that women, she just scared that she's gonna pee herself and her partner every time they have sex. So it creates this fear, this desire to avoid sexual activity, but they can't just like tell everyone, hey, I'm afraid of peeing on myself and my partner, that's why I don't want to have sex. So it's kind of a little bit easier to go and try to work through couples therapist or sex therapist. And
wait, may I just interrupt you? Like, it's so incredible what you're saying, Dr. Dubinskaya, that the easier, more emotionally comfortable option is couples therapy and sex therapy. I mean, that is so intense because so many people just don't want to go there. But that is the more pleasant, easy option. That's amazing.
this is the option that becomes more and more available to people. And again, it's more like socially appropriate to go to couples therapists, to sex therapists, which is great. But I do see patients who've been to like a therapy for several years and it's still not working, but it's not because the therapy wrong. It's just because we need to fix incontinence. And again, therapists, they good at what they do. But I think it's very important also to get to the bottom and like no pun intended and figure out what else is going on, what else is preventing women to enjoy sexual activity, because all this pelvic floor issue get worse as we get older.
Okay, so let's reverse engineer this with there are a lot of reasons to have urogynecological issues fixed. But let's just start with the simple and wonderful goal of having great sex. And in order to have great sex, I was going to say you want everything to function properly. Actually, there are ways to have really great sex when a lot of different things don't function properly. But let's just go with wanting everything to function properly in order to make great sex easy, pleasure-filled, and accessible. So if that's our goal, let's talk about the different symptoms that a woman might have and what appropriate next steps would be to take it. So let's just start with the woman who maybe she gave birth recently, maybe it's been 8 years, but the point is she's continuing to menstruate. And the only very clear change in her pelvic physiology is that she's given birth. And she has some urine leakage. When she coughs, every time she gets a cold, she uses pads because tampons don't really help with urine leakage, just to be really clear about this. She needs pads when she has a cold, when she's coughing, but the rest of the time she doesn't really pay attention to it. She like forgets about it until she's sick, and then she's like, oh, right, I forgot this is how I am. So she like wears more sweatpants and layers and, darker clothes and has her pads on when she's coughing and sneezing. What do you recommend in that situation, which even though I'm being like a little dramatic to make the point, relatively speaking, it's a very mild situation because it only happens when she's sick and, maybe she's sick for a week or two a year.
Yeah. So, one of the things that surprises me that until this day in the United States, pelvic floor physical therapy is not part of the recovery from being pregnant and having a baby, which is very helpful because it's rehab. You're rehabbing your pelvic floor muscles that did such incredible work for like 9 months. And if you had the vaginal delivery, pushed out the baby. So this is, I think, the most important step to take when you had a delivery. Then we're taking in consideration that a lot of women, they breastfeed. And when we breastfeed, there is a hormonal changes happening, and it changes the lining of our vaginal wall, and it can get drier, kind of similar changes that happens in like post-menopause. So it's very important to address that, because if you're not addressing it, pain will hurt. And because you have pain, you're not going to want to engage in sexual activity down the road. The leakage with physical activity, we call it stress urinary incontinence, is common after vaginal birth. And if it's just a mild symptoms, and let's say they not interfere with your sex life, they not really bother you unless you have a cold, you'd not necessarily need to address it, but I would recommend going to pelvic floor physical therapy just to assess your pelvic floor and make sure you know how to do your exercise, that the muscles that relax, like need to be relaxed, they relaxed. If it gets worse, where it starts bothering you, there is definitely like indication to go see your gynecologist, because there are options that can be offered. For example, urethral bulking agent. It's a fancy name. It's basically like to have a fillers, like similar how women have a fillers in their face. We put similar fillers in the urethra, so the urine does not come out when women exercising. or have a sling done, basically the gold standard treatment for stress urinary incontinence, which is outpatient procedure. But the degree of like how much intervention one needs, it basically depends on how much woman bothered.
Okay, that makes sense. And for a woman who wants to be proactive, like I don't remember the specifics, but I know that there are countries that have amazing postpartum care, and it's just routine the same way, I don't know, you're sent home with an ice pack, you're sent home with a referral to pelvic floor therapy. But for someone who's going to be initiating that themselves, basically most of my listeners, how soon should that first appointment be made after birth?
2 points I want to make. One, to answer your first question, you can make appointment at about 6 weeks. Obviously, it depends if you had extensive tear, difficult birth. Of course, you will need longer to recover. And if you had a relatively easier birth, I think at 6 weeks, you can totally go and do it.
So basically when things feel normal again. I
Exactly.
know that's very vague, but that's a woman who's given birth can understand what that means.
Yes. So, but usually we use this like 6 weeks, but it doesn't mean that if at 6 weeks you don't feel like up for it, that something wrong with you. Is just you need a longer time to recover. And the second important point that I want to make is, unfortunately, we initiate this education about pelvic floor after birth, when the women have problems. And we never talk about it before women get pregnant or while they're pregnant. For some reason, it's not a part of regular conversation with a general OBGYN. And again, I went through OBGYN training, and it's always surprised me how we say all the bad things about C-section and all the good things about vaginal birth, but never
Not the reverse.
right. So, and I think like, and again, I came from Russia. We never had informed consent. I learned about informed consent here. And I think what women going through right now with the birth, it's not a real informed consent because they are not informed. And I'm sure if women would know all the risk associated with like pushing out the baby, significant amount of them would choose to have a C-section. And again, C-section also like not a benign procedure. It's kind of like pick your poison. But I think every woman should have this knowledge and choice of what suits them most.
Yes, although I would add that I feel like it's not just vaginal birth versus C-section, it's also vaginal birth with or without proper postpartum care and actual rest. That, you know, whatever vaginal birth occurs, it doesn't mean a woman is necessarily committed to certain consequences. There are ways to like mitigate that after birth. And I'm only saying this, I see you nodding, so I'm happy that you agree with this, but I just think in general, convalescence after birth is so misunderstood in our country. We celebrate getting back and, running a marathon or hosting a party 4 days after a C-section. Like, we celebrate overdoing it, whereas it's so clear that the more a woman rests physically and emotionally and every other which way, the more she rests right after birth, the sooner she has her pre-pregnancy energy and vitality back. So that's why I was like inserting that. That's one of the things that I've never actually talked about, but I feel so strongly about.
I agree with you. And you know what's interesting? Like, I think like it's only projects for women, but I never seen a man who had like, I don't know, ACL repair, and then we're like posting pictures on Instagram like, hey, I served like 6 hours after having my ACL repaired. Like, there's no man would do that. But for some reason, we women like to be like so heroic about it, like push baby out of epidural, like without epidural, like doing all this stuff. Plus, we have like a newborn who also like puts us in a condition of like sleep deprivation, exhaustion, hormonal like imbalance, all of that. And I think somehow we do need to, like, we do it to ourselves. And
yes, Well, and I think that that's probably relevant after any of these procedures as well. But we talked about the scenario with like just when someone's sick, a few weeks a year, maybe, like a massive sneeze and there's a little bit of urine, but it's really not impacting lifestyle other than needing to, you know, change your pants very occasionally, which, of course can be significant. But now let's move on. Someone is, let's say a woman, every day there's a teeny bit of leakage, just, with laughter, with running. I don't know. Maybe you want to give like what would be the next scenario, but I just know that every woman listening, statistically, she's likely to recognize some level of leakage. And so I'd love you to be able to say, okay, what would be an appropriate step if you're in that phase? So let's talk about mild. Definitely, she's not thinking, oh, I need a surgical repair. It's just she's forgotten what it's like not to, have some leakage every day.
Yeah. Well, in general, if we're talking about the stress urinary incontinence, we can always do something before going for surgery. You mentioned tampon. The tampon doesn't absorb the pee. However, if we take a large tampon and we insert it in the vagina, it's going to compress the urethra. And if somebody has a very mild leakage, it actually will help prevent urine from leaking out. Obviously, it's not the perfect solution, but it's definitely like you worth trying. Then there are also a fancier, larger tampons that made specifically for urinary incontinence. They called Impressa. They sold in any pharmacy.
So they're
Basically, look like a large
non-prescription?
tampon. I'm sorry?
Do you need a prescription for those, or you can just walk into the pharmacy and get these like pressure tampons, basically?
No prescription is necessary. Anyone can get them, and they actually come in different sizes, so you can get a mix of the sizes and try them on. The next step after that would be pessary. Pessary is a silicone device that's been out for many years. And for the urinary incontinence, there is a special pessary with a little knob that also compresses the urethra and prevents the urine from leaking out. Also, again, there's pelvic physical therapy. And then the next step is already like a little bit more invasive, like injection of like fillers or slings. And some women want to start like kind of like step by step, little by little, which is totally fine. And some women, they are more bothered and they just want to do like one procedure and move on with their life. So it all depends. But there's not only urinary leakage with physical activities, there is also overreactive bladder. Basically, people, like these people who always go to the bathroom, always need to go and pee before they leave the house. When they arrive to the destination, they know all the bathrooms in the mall. So it's overreactive bladder. And it can also associate with leakage. Whenever you feel the strong urge to go, the urine comes out.
I've had very big babies, and so I have paid attention during medical training, and I am very familiar with the symptoms and management of stress incontinence. But with overactive bladder, like what makes someone at risk for that? What is the cause?
Yeah, so nobody is safe. Anyone can develop it. And there are some young people who can have it and some older people who have it. There are some fluids like sparkling water, soda, coffee, alcohol can make your bladder more irritated and contract more and feel that urgency. Or it could be just what your body does. Your muscles of the bladder keep contracting uncontrollably and you perceive it as urge.
Okay, so it could be muscular or it could be essentially overstimulation of the nerves.
Well, I would say it's mostly just like basically you irritate the bladder muscles and it starts contracting.
I understand. Okay.
Yes. And there are also different things that can be done. And again, this actually overactive bladder is more likely to bring women to the doctor than stress urinary incontinence. Because with stress urinary incontinence, you can control it, you can adjust your life. But with overactive bladder, it's independent on you. Like you can decrease the fluid you drink, you can never drink like sparkling water, but it's still happening. And it's very frustrating. So you don't know when it's going to happen next time. And it's going to happen during sexual activity as well, like a bladder spasm. So women usually come to the doctors, and there is also different options. There could be medications for people who don't like to take systemic medication. They can have a local treatment. We inject Botox in the bladder that basically relaxes bladder muscles, and they stop contracting uncontrollably. And there is also acupuncture for the bladder and bladder implant. It's kind of like a bladder pacemaker, similar to the heart pacemaker. We can place similar one for the bladder. So it kind of buys you time between feeling the urge and when the urine comes out. And it's kind of like also like calms down the bladder muscle, retrains the bladder nerves. So it kind of goes back to normal functioning.
Have you basically covered, like, I have to just say, I don't have a reason to be current with this, and there are so many different treatments. It's actually kind of amazing, which means it would be very worthwhile to see a specialist like you to really be able to assess which of the many treatments would be most relevant, most beneficial. But are there other treatments you haven't mentioned before I ask a different question?
Yeah, so I mean, there's also vaginal estrogen that when we use it, especially in perimenopausal, post-menopausal women, can help with that urinary urgency and actually decrease the severity of the disease significantly. There are also, again, pelvic floor physical therapy for overactive bladder also helps. And then, believe it or not, vibrators. Using vibrators improves the blood flow to the area, and it actually kind of helps in some sort of rehabbing your pelvic floor as well. So vibrators is actually good for you.
Everyone should take heed. That reminds me a little bit of the kind of use it or lose it principle, which is such a casual thing, but pertains in this way. When there's leakage during sex, obviously shame, embarrassment, like just that is an issue. But if we put that aside and like both people are just kind of relaxed and accepting of what happens, does it otherwise influence the sexual experience? Does it, does it do anything to the amount of pleasure a woman can feel, for example?
Usually not, but I yet to meet a woman who wouldn't care about her leakage. So I think it's mostly also psychologically knowing that there is a chance that that might happen. And I think that what would preclude women to feeling like the maximum amount of pleasure and feeling relaxed.
Because she's just going to be contracted, like psychologically contracted, and that then restricts the amount of pleasure.
Right, right. And like some of the tricks that I usually offer the patient who's not ready to like have a surgery or any other intervention, I usually propose to them idea, okay, have a sex in the shower or in the bathtub. So at least you and your partner kind of like don't know when it happened.
That's such a smart idea. Yes. Are you familiar with PeriFit?
The PeriFit to insert in the urethra?
No, I mean that may be a PeriFit, but no, it's just like on the market. I got Instagram ads for it. PeriFit. It's a device that basically trains you to do effective Kegels because you like play video games with it through contracting your pelvic floor muscles.
Yeah, so there are multiple devices of this type on the market. I think that device is good if, first of all, you went to pelvic floor physical therapist and we assessed your pelvic floor. We knew that Kegels is what you need. And then you have an issue with contracting your pelvis because not everyone can like recruit those muscles groups. So then I think that device is really good option.
Because it gives you immediate feedback on how well you're doing.
Exactly. But there is this notion that everyone needs Kegel, but actually not everyone. And there are numerous amount of women who actually have a very tight pelvic floor. And because the muscles are so tight, so contracted, they can't perform, they function appropriately. So for those women, doing Kegels only going to do wrong. So that's why it's important to be evaluated first. And if Kegels what you need, then PeriFeed would be a great option.
Yeah, you know, I went to a pelvic floor therapist after having my third child, and I was just astonished because I thought I didn't have good Kegel control. That's one of the reasons I went, is like I felt like I was just altogether weaker. And in fact, I mean, my muscles grew stronger through the pelvic floor therapy, but the thing that I just didn't expect it. I didn't really even know how to think about it. I still don't totally. And that is that my biggest challenge was relaxing my pelvic muscles. And I just, it's like, it was such a sort of confronting experience because on the one hand, I felt weak, but on the other hand, I couldn't relax. And I just found it really hard to learn how to relax those muscles. Why is it that, I'm not aware of any, I guess like we get, I don't know, tight Achilles tendon area. Like there are places where we get tight and stressed, but you know, or like neck strain. How does it happen that through birth or whatever it is that the pelvic floor muscles stay so tight?
Yeah, and I think it's also not only that every muscle is tight, it's also harmony of working together, because everything is kind of like, for example, when we pee, our sphincter muscle has to relax and our bladder muscle has to contract to push out urine. So it's kind of like the antagonistic activity. Or when the bowel movement happens, same thing. And for some reason, some women just, that's how they function. They just, muscles work against each other. It also can happen after vaginal birth because when the pushing happening, when the baby goes through the birthing canal, there's a tremendous impact on the like pudendal nerve of the nerves on the pelvis that being stretched like with several centimeters when it happens. So it does create some injury. So it can impact how the muscles interact with each other.
Like how they come back to normal state, they don't quite get there.
Like how to even like when one muscle needs to relax, when another muscle needs to contract. And also similar how like anywhere in our body, you can get like a Charlie horse in your pelvis. And it's also kind of like a prolonged Charlie horse, and you cannot do anything with that. It's just going to stay like that. And some people, it's so bad that they can't actually pee. They're retaining the urine because the pelvic floor is so strong. So it's again, going back to the point, like doing Kegels is not for everyone. Some people might feel like, oh, I'm weak, but they actually muscles working very hard and you don't want them to work harder.
Yeah, I definitely was an example of that for sure. I'm so grateful to like get into all these nitty-gritty details and ways of thinking so that really any woman with leakage can kind of place herself on the spectrum and figure out what the next steps are. And I want to just like step back a little bit. I thought we would begin here, but instead we're going to wind up here, which is that having great sex is really a quality of feeling. It's not about one sexual position or another, or, you know, mastering the different postures and acrobatics of the Kama Sutra. No, what makes for great sex is that it feels really good. Now, it's not that sexual position has nothing to do with how it feels, but it's definitely not the whole thing either. Like how we feel during sex has to do with how loving we feel, how open our heart is versus contracted, how sleep deprived we are or how rested. Like it has so much to do with our different feelings as well as our appearance, like, is this an angle where my belly hangs over? Or, that in itself can get in our head and we can be having a really erotically gratifying experience. And then it just sort of fizzles because, I caught my belly or the way my breasts were hanging over and, like, oh. And so I think we're used to in our society knowing that's an issue with like our overall appearance. Like, does my hair look good? Are my breasts like perky enough or hanging too far down or whatever? And like, does my ass look good? Does my belly look good? What? But I wonder if you have any insights from the work you do on also how people get about how their genitals look. Like, it's not so much how our pelvic floors look. We're not really inspecting that, but labia majora, labia minora, just the overall vaginal region, that if somebody feels like it's not attractive, that has such an impact. Is that something that you encounter or you want to speak to?
Of course. And it's like, I would say it's one of the 5 top complaints that I hear from patients. Because again, as we age, giving birth, some hormonal changes, it does change like the genital area, how it looks, vulva, labia, clitoris. And similar to how some people get more wrinkles or more hanging skin on the face, same thing can happen in the genital area. And same way how you might feel uncomfortable with how your face looks, you might feel uncomfortable how your southern face looks. So it's totally valid concerns. And I think currently there is also like this notion in general OBGYN to validate that it's normal, and everyone goes through that. But I don't know about you and our listeners. You can tell me that it's normal when I have wrinkles on my forehead. You can tell me all day long, I'm still going to go and get Botox done because I don't like this wrinkle. And I know my friends also don't like that. So when something goes wrong in the genital area, like a lot of women want it to look pretty and get it fixed no matter what other people say. So it's very common. So there's also obviously like some beautifications procedures that are done, like labiaplasty, like clitoral hood reduction. Also, after vaginal birth, the vaginal openings tend to be a little bit more open. So we can do like vaginal tightness. And it's also
a reverse episiotomy.
Kind of, yes. And it's also very important to, if you decide to do that, to go to the person who knows what what he or she doing, because over tightening can also cause pain with sexual activity. So everything in moderation is very important. Also speaking about pelvic floor disorders, pelvic organ prolapse, when organs just basically protruding through the vagina, and it could be bladder, uterus, and bowel. It can affect how women feel. It's not life-threatening, but certain positions might be uncomfortable. And also, again, when I see my patients and they're asking me like, oh, like I have a uterine prolapse, can I continue having sex? You can, but gravity is not your friend. So don't have sex like standing up, sitting up. Like you better served in like laying down position. So it's also kind of like adjusting how you do things can be helpful. Obviously, like there are surgeries that can fix it. But if you're not at the point where you want to have surgery, it's also important to like have it in consideration. Similar how we know like, okay, like my right side is the best side. In this position, my belly is hanging. So it's similar for the pelvic organ prolapse. It's important to be aware of it and know that certain positions for certain types of prolapse not going to be the best, and it's actually going to interact with your experience, with your pleasure.
I was part of an art project at one point, which literally was just like a grid. I don't remember how far apart, left to right, or how many down, top to bottom, but it was just these squares of images of genitals. I mean, female genitals, because I think like there's not wanting to have wrinkles, feeling we look funny. Like I really connect with what you're saying about that. And also there's the fact that most of us aren't actually seeing genitals, aren't seeing labia. You know, if we're not OBGYNs, then we don't really have a context to be seeing the full spectrum of what women look like. And then our references generally are from porn, like that, from porn or from our babies.
Totally. And it's kind of like I know how my height compares to my neighbor's height, but I can't compare my genitalia to like my neighbor genitalia. And I think like pornography, it can be good and bad. Like there is this also belief that like every woman who want to have a labiaplasty, she probably watched porn and now she was inspired. But we still don't know. Is it like what you were seeing down below inspire you to go out and seek information how other people's genitalia look? Or you just accidentally watched porn and noticed that it's not the same as like what you have. So we still don't know that. And I don't know if there's any way to determine that. But yeah, pornography is one of their largest library of the images for the genitalia. So obviously we're comparing to it. There was a studies done that showed that actually for men, pornography influenced how they perceive the penis size. So for women, I'm sure it's the same.
Yeah, you know, I'm reminded during my gross anatomy lab, first year of medical school, it was, I mean, it's a very basic idea, but it was shocking to me because I, of course, am used to thinking that we all have unique appearances externally, you know, your nose and my nose, your hair and my hair, you know, like that's how we recognize people because we have a unique appearance. But I think I just had this idea that as long as everything was healthy, below the level of the skin, it was all the same. I mean, maybe bigger and smaller because I'm a shorter person. So, you know, then maybe my organs wouldn't be as big as someone who's, you know, a basketball player. But it was just, I mean, I never consciously thought about it, but I realized I had this assumption that I've just stated. And then during gross anatomy, it was just astonishing how, like, we all have livers that look different, and we all have esophaguses that look different, and we all have bladders that look different, and that our uniqueness and the unique appearance of us, which is evident on the outside, carries on to the inside. And I'm really just saying that because that is also true when it comes to our genitalia. You know, in a lineup, our sexual partners should be able, as long as we don't always have sex in the dark, our sexual partner should be able to pick out our genitalia because it also is unique. And I just think that that's why this art project was so valuable for me to like see just walls and walls of different, you know, I see your point because even if people are different, we still think, oh, well, this is prettier. I want to be more like that. But still having a sense of what is normal is so helpful. Well, this has been like a kind of primer for all things urogynecology. I don't know, maybe there are topics we didn't discuss, but as far as I'm concerned, it was a primer covering all of the important topics that a woman is going to encounter. Should she live long enough, she will encounter some number of the things that we've discussed. So is there anything else that you think should be part of this conversation before we wrap up?
Well, I think I wanna remind women that majority of cases we know when something is a little bit off. We have this internal voice, and sometimes we just try not to hear, like not to listen to that voice. So I think if you hear that something is off, just know that there are specialists who will be able to help you to figure out and to, you know, there's like so many things to worry about in our life. And I think the pelvic floor should not be one of them.
Oh my gosh,
So
that should be a bumper sticker. That's so great. With all the
like
things there are to worry about in life, let's not have the pelvic floor be one of them.
exactly. And again, I really hope like the goal is like in my life to actually to not have patients that everyone like so healthy and the pelvic floor is so in a good, like in such a good condition. But if you find yourself that there is an issue, please find urogynecologists and get appointment and get everything assessed, because there are so many treatment options that there is just like no reason to peeing your pants, wearing pads. You should be able to wear your white jeans without any worry and have sex in any sort of position you want without experiencing pain.
Okay, that's so good. And if somebody is in the LA area and they want you to be the one who helps them figure out the best next steps in terms of treatment and resolution, what's the best way to find you?
You can go on my website, drurogyn.com, and you can register on the patient portal and book an appointment, or you can call our office, 424-210-9030.
Dr. Dubinskaya, thank you for such an educational and I want to say like super straightforward conversation about something that you and I both think should be straightforward, but usually is not. And I just, Alexandra to Alexandra, thoroughly enjoy being able to provide this conversation for people. Thank you so much.
Thank you so much for having me. It was a pleasure.